We found out about Joy's scoliosis when she was experiencing pain last fall. Just out of the blue, it seemed, she just started saying, my back hurts. And, at first you think, it'll pass, maybe it's growing pains. But she kept complaining about it. It just didn't go away.
I had been experiencing a lot of pain in my lower back, and a lot of times it affected my sleeping, and I couldn't play with my friends as much because it was like kind of making me a little bit weak, and so I couldn't really be as energetic as I normally am.
Adolescents with scoliosis typically do not feel any type of pain at all. In fact, 95% of cases, their patients feel very little pain. 5% do. They can feel different types of pain. It can be normally described as a dull muscle type of ache that could typically interfere with, with activities and normally exacerbated or made worse with activities, like things like they walk for a long time, they stand for a long time, they sit for a long time, they will feel increased pain, and it's typically low back pain. With Joy, we just had dull, achy type of pain that was interfering with her activities and things that she was doing. So we weren't really concerned about a neuromuscular problem. I felt like this was being all caused from her scoliosis, and the scoliosis had to be reduced and managed in order for her to get better.
We took her to a local chiropractor, and he did the initial normal x-rays. And I believe it was the next day, we came back to get the results, and we sat in his office, and I looked at the screen and saw this huge curve in her back that we had no idea existed. It was a huge shock. From there, the chiropractor recommended that we see our family doctor and then go from there. So we made an appointment, but meanwhile, in the waiting, we just did the weekly chiropractic visits, which helped her in some ways with the pain that she was experiencing, but we knew it wouldn't be enough. So that's when we went to our family physician, and it only took a few seconds for her doing the test of bending over and seeing her spine, that she knew she needed to refer us. And when we finally did go to the orthopedic surgeon, it was disheartening, to say the least. Not that he intended to be, but we felt like he was kind of dismissive of her pain. He actually told us that he doesn't believe that scoliosis causes pain. I had said, have you heard of other methods like using a scoli brace? And again, he was dismissive and said he didn't think there were enough studies to support it. So he just gave me a prescription for Joy to get a traditional brace and said, come back months from now and we'll see. I went home in tears because I felt like it just didn't feel like that was the right answer.
90% of all scoliosis cases are diagnosed as idiopathic scoliosis. The definition of idiopathic means unknown cause. Now, we believe that scoliosis is a multifactorial problem, meaning that there is many different causations of scoliosis, and the curve in the spine is a symptom from many other things that could have possibly have caused it. What causes the scoliosis isn't, in most cases, it's almost irrelevant, because when we get to adolescents and they start to grow, it's the growth that causes the progression, not what caused it. We believe what caused it, in most cases, resolves itself and it's gone. So therefore, the reason why there's not a lot of knowledge about what causes it, because I don't think we'll ever find the single cause. Now, what is frustrating though is what happens to scoliosis is very predictable. We expect curves to progress very slowly in juvenile years, hit adolescence, progress very, very rapidly, slow down progression into the adult stage, and now progress very slowly because of gravity in the adult stage into late stage life where it starts to accelerate. That knowledge, a lot of doctors don't know that because they're not trained in scoliosis and they give bad advice. Now that is frustrating because patients make decisions regarding their care, regarding advice. Oh, don't worry about it. It's not going to be, they're given all this like, don't worry about it thing, not understanding the risk factors at critical times when patients are growing, like Joy.
I also pretty much immediately looked up alternative treatments. One of the first results was Dr. Nalda's clinic, the Scoliosis Reduction Center. Just from the first words on the site, I believe it says something like, if you've just received a diagnosis, you're probably scared and confused, and I'm here to help you. And that was just, to a mom, that was exactly what I needed to hear. When we had a phone consultation with Dr. Nalda, before I even asked what his goal was, he said, if you choose to come here, my goal for Joy is that she feels better and that her curve is reduced.
When I met Dr. Tony, I was just immediately like, wow, I love him. Was a very good first impression, and unlike the other doctor, Dr. Tony is just like a friend who wants to have a conversation with you. Dr. Tony wants to help people because he experienced it himself.
What intensive care is, it condenses this 12-month rehabilitation into a 2-week cycle where a patient will experience 6 to 8 hours of therapy, rehabilitation, exercise, traction, vibration, chiropractic care, all these different types of therapy and rehab into a condensed format where we have enough intensity and energy to actually reduce the curve. When you actually reduce the curve, patients do better because you're actually correcting the cause or reducing the cause of their problem. And now we have to stabilize that reduction so it can be more long-lasting. So that's why the intensive care is so effective, because it treats the patient like a scoliosis patient. It doesn't treat them like a patient that has had an injury. And that's where that differentiation has to happen.
The people here, the staff, is so kind and caring. It's so obvious that they really want their patients to get better. So we're at the very end of our 2 weeks, and he gave us he showed us the x-rays, and I cried with tears of happiness because of the difference that we saw. In one area of her back, she went from having a mild scoliosis to having technically no scoliosis at all. And in other areas, she had moderate, and now it's mild. So in less than 2 weeks, that's just incredible to me.
So if anyone has any doubts about this place, you're gonna love it.